Good afternoon, I'm Alan Unell, and this series of videos is Healthcare Advocacy, where we address problems in the healthcare system, then take actions to make a better system for all of us. Down below, you'll find a link to the Healthcare Advocacy newsletter. That's the text for today's message. We're going to talk about Medicare Advantage and commercial insurance for healthcare in the United States today. There are some problems that have been showing up. And it turns out that hospitals are getting fed up with Medicare Advantage. Let's have some background information. Oh, before I go too far, the newsletter down below, that is the text for today's lecture video, contains links to stories, analysis, studies, actions that we're going to take. All of it's in there, and you can subscribe for free. Medicare Advantage provides health coverage to more than half of the nation's seniors, but a growing number of hospitals and health systems nationwide are pushing back and dropping some or all contracts with the private plans altogether. Now, I want you to remember that Medicare Advantage, even though it has the Medicare name in there, it is really private insurance, not traditional Medicare. So private companies, for-profit companies are doing this. Medicare, traditional Medicare, is a public insurance paying private providers. Different thing. Anyway, among the most commonly cited reasons for these cancellations are excessive prior authorizations, denial rates, and slow payments from the insurers. Some systems have noted that most Medicare Advantage carriers have faced allegations of billing fraud from the federal government and are being probed by lawmakers over their high denial rates. According to San Diego, California-based Scripps Health, it is a game of delay and then deny and then don't pay. They've had enough, and Scripps said they have just stopped doing business with all Medicare Advantage plans. And it's a big decision for them because it affects 30,000 of their patients and 1,000 of their doctors. I include in the newsletter a link to a Becker's Hospital Review article from November of 2023, and it listed 13 instances of hospitals dropping Medicare Advantage. I'm not going to repeat them to you. You have no insurance, you have insurance, and you have no place to use it to get the health care you need. You have insurance and you can't use it. That's not what anybody signed up for. I fear that this is actually just the start, that we may wind up seeing this spread far out of the Medicare Advantage world and just into the commercial insurance world, where certain insurance companies are just not welcomed by certain providers. Anyway, let's take an action about this because this system is not going to get better. It's only going to get worse. We need to remind our legislators in Congress that healthcare needs reform. Universal healthcare would fix the problems we described. You can find their contact information down in the resources section, or you can use RESISTBOT and send a text message from your cell phone to 50409. Here's the message. SIGN, SIGN, space, PZVFOJ. Peter, Zebra, Very, Frank, O.J. And here's the message that you'll send. It's pretty simple. I'm your constituent, and I want you to know that there are major hospital systems refusing to do business with Medicare Advantage commercial insurance plans. The report was written in Becker's Hospital Review, and here's a link to it down below. And the link is in the email so that they can read it. This leaves hundreds of thousands of seniors in the lurch. The problem is that commercial insurance practices delay, deny, and don't pay enough of the time, so hospitals can't afford to continue with them. Of course, these same companies sell health insurance to all of us, Medicare or not, and so the problem will only grow. Universal healthcare fixes this by paying fair amounts to every provider using global budgets. Everyone in, no one out, cradle to grave, for hundreds of billions of dollars a year less every year, according to the Congressional Budget Office. I encourage you to read the text of H.R. 3421, the vastly improved Medicare for All Act, and then pass it. Thank you. Let's talk about the state of Alabama. In vitro fertilization there has been halted. You may recall that the Alabama Supreme Court declared that frozen embryos are to be accorded the same rights as children, and destruction of unneeded embryos would be a crime. From Axios, and of course there's a link to the story in the newsletter, the University of Alabama at Birmingham has paused in vitro fertilization treatments, citing the potential that our patients and our physicians could be prosecuted criminally or face punitive damages for following the standard of care. Medical professionals throughout the state are now questioning whether they'll need to overhaul their approach to in vitro fertilization, most likely in ways that would make it riskier, more expensive, and more painful for women trying to conceive. Nationwide, IVF accounts for 2% of all births, and there's a link to that reference. According to UNICEF, there were 3,745,361 babies born in the U.S. in 2023. 2% of that is 74,907 babies that come from in vitro fertilization. This is a serious matter. Let's talk briefly about another topic, smartwatches and blood sugar. It turns out they are not ready for prime time. Smartwatches and rings, Bluetooth rings, or near-field rings, that claim to measure blood sugar levels for medical purposes without piercing the skin could be dangerous and should be avoided, the U.S. Food and Drug Administration warned this week. The caution applies to any watch or ring, regardless of brand, that claims to measure blood glucose levels in a non-invasive way, the agency said. The FDA said it has not authorized any such device. The agency's notice does not apply to smartwatch apps that are linked to sensors, such as continuous glucose monitoring systems that measure blood sugar directly. They actually stick with a little adhesive on the body, but they actually pierce the skin so that they can measure. Using the unapproved smartwatch and smart ring devices could result in inaccurate blood sugar measurements with potentially devastating consequences, said Dr. Robert Gabay of the American Diabetes Association. That could cause patients to take the wrong doses of medication, leading to dangerous levels of blood sugar, possibly mental confusion, coma, or death. The FDA-approved monitors, the ones I just mentioned, are available at pretty much any pharmacy, and they are very low risk. And personally, I have a friend who uses one, and he is super pleased with the results. He's now able to keep his blood sugar in check really easily. Okay, let's talk about women's health research. This was big news this morning. The Biden administration has pledged to invest $100 million for women's health research. First Lady Jill Biden made the announcement yesterday. The investment is part of federal efforts to close gender gaps in research, which supporters say have led to insufficient funding for things like endometriosis, multiple sclerosis, and other conditions that disproportionately affect women. It's a start. More investment would be more better. Let's take an extra credit action. And there is a link in the newsletter below to the White House. And you can just send them a note. I'm going to read you the note that I sent them. You can send them what you'd like. Thank you for investing $100 million in research focused on the medical issues faced by women. I'm glad you've taken this important step. We look forward to better health care for women as a result. Please make sure it continues. Again, thank you. That's the newsletter. You can send me comments down below, like, share, or subscribe. You can subscribe to Healthcare Advocacy's newsletter and get it delivered to your inbox every day. You can also send me comments or suggestions for research to healthcareadvocacy1@gmail.com. Thanks. We'll talk later.